Insomnia gets overlooked in trucking. Everyone talks about sleep apnea, and for good reason. But insomnia can be just as dangerous behind the wheel, and a lot of drivers don't realize it can come up during their DOT physical. Here's what you need to know before you walk into that exam room. Insomnia means you're having trouble falling asleep, staying asleep, or you're waking up too early and can't get back down. Short-term insomnia is common. Stress, life changes, schedule disruptions. Chronic insomnia is when it's been going on for 3 months or more. Either way, if it's affecting your alertness on the road, it matters to a DOT medical exam. The research on this is clear. Sleep deprivation hits your brain the same way alcohol does. Slowed reaction time, poor judgment, trouble concentrating, and then there are micro-sleep episodes. Those are brief, involuntary moments where your brain just checks out for a few seconds. At highway speeds, a few seconds is enough to end someone's life. So when you sit down for your DOT physical, the certified medical examiner is going to go through your health history, your symptoms, and your medications. If insomnia comes up, either because you mention it or because it's already in your records, the examiner is going to want to know how you're managing it. There is no automatic disqualification for insomnia under FMCSA regulations. But that doesn't mean it's automatically fine either. The examiner has to determine you're fit to operate a commercial motor vehicle safely. That judgment call depends heavily on how the condition is being treated. Medications are where things get complicated. The FMCSA doesn't publish a list of approved or banned medications. It's case by case. What the examiner is looking at is whether your medication could impair your ability to drive. Prescription sleep aids, benzodiazepines, certain sedative hypnotics often raise concerns because of next-day sedation and cognitive effects. Over-the-counter options with diphenhydramine, which is in a lot of common sleep aids, can do the same thing. Bring a complete medication list to your exam. Everything. Prescriptions, supplements, anything you take to sleep. Leaving something off that list isn't just a risk to your certification. It's considered fraud. The treatment approach that raises 0 red flags for CDL drivers is called CBTI, Cognitive Behavioral Therapy for Insomnia. Sleep specialists consider it the first-line treatment. No medication, no next-day impairment, and it actually addresses the root cause instead of just masking symptoms. If you haven't looked into it, it's worth asking your clinician about. The practical takeaway here is simple. Don't wait until your DOT physical is 2 weeks away to deal with a sleep problem. Start working with a healthcare provider now. Document your treatment and arrive at your exam with a clear picture of how you're managing your health.